Greetings from Citizen Health and the Team Academy IAPS Semi Connect. And after a long time, when we are restarting this series, we have Dr. Vallepalli Chandrasekhar. He is an associate professor in Department of Community Medicine, Sri Padmavathi Medical College for Women, Tirupati, Andhra Pradesh. A very warm welcome to you, sir. And I would like to introduce you to our audience as a national level first aid master trainer, BLS instructor, and ICRF NHQ. A very warm welcome to you, sir, on this board.
Yeah, thank you.
Today we are going to talk about some first aid techniques. And should I continue, sir?
Sure. Yes, please.
Yeah, I ask you few questions about first aid, and I would like to ask my first question that what is first aid, and what are some common injuries or emergencies that may require first aid?
Yeah, so this is a very important topic, basic first aid. So every citizen should know regarding this topic. So this first aid refers to the immediate medical assistance and the care which is given to an injured or ill person before the professional medical help arrives, like an ambulance before arriving in the scene. So whatever a person or any individual who is giving medical assistance, it can be considered as first aid. And having this knowledge is also very, very important for all the individuals. And there are some common emergencies or injuries that may require first aid. These include like simple cuts or burns, fractures or sprains, leading to choking sometimes, or very importantly, cardiac arrest. We are seeing a lot of cases now which are occurring in young, and again, bleeding, poisoning, or even unconscious state which requires first aid, and also some animal bites or snake bite, etc. will also be requiring this first aid. Yeah.
Okay, so sir, what are the key principles to keep in mind when administering first aid?
Yeah. So again, why we are doing this first aid means like to preserve the life mainly, so to save the life of the person, and again to prevent further injury or worsening, and also to promote the recovery. Okay, that is very important, and this will be can be provided by anyone. Like previously, we see like only police or bomb fighters, only from Red Cross or St. John's ambulance you use it to give the first aid. But now everyone has to give, like relatives or family, friends, teachers, even medical students has to learn this skill, and even everybody can do. But once you're trained, you can deliver the appropriate or correct technique so that the person's life will be saved.
Right, sir. And are there any basic first aid procedure that people should know?
Yeah. So again, there are some very basic procedures because some were mandated by National Medical Council also. Like very important, one of thing is CPR. That's a very basic procedure everyone should know, like cardiopulmonary resuscitation. And again, one more thing is Heimlich maneuver, which we do for a choking victims. Then again, treating some bleeding or applying some pressure to wounds or managing burns, recognizing and responding to heart attacks or strokes, and stabilizing the broken bones or fractures. So these are some basic first aid procedures which can be invaluable in emergency situations.
Okay, sir. I can understand that there are several emergencies, but let just focus on if we focus on unconscious individual. What do you think, sir? How should a person approach an unconscious individual?
Okay, so this anyone can encounter this type of situation. Okay, when we are in a mall or outside or on the road, some person may become unconscious. Okay, so again, first we have to should not touch the victim. First, we have to check the danger around the person. But sometimes it may be electrocution also. Okay, so first the danger we have to check. Then we will check the responsiveness whether the person is responsive or not by tapping on the shoulders and shouting, giving some verbal commands and tactile commands. And if there is still no response, again we have to immediately call for emergency, like in a telephonic emergency number. And again we have to assess the breathing and pulse. If there is no breathing and no response, you have to start immediately CPR. This is very basic procedures and very important, which we do in unconscious individuals.
Okay, so now you are mentioning the CPR. I would like to know that what is CPR and what is the process and how a person can do it. Can a normal non-medical person also do it or not?
Yeah. So again, CPR is a very basic procedure that is called as cardiopulmonary resuscitation. Any person who is having two hands can do CPR. So this is a very beauty. So simple, with two hands we can save a life of a victim. So this is a life-saving technique used in the cardiac arrest, or when a person's heartbeat or breathing was stopped. Yes.
Okay, so means how to do CPR, if you can demonstrate a little bit of procedure so that one can understand.
Okay. So again, we have to do immediately as early as possible, like what we say, like American Heart Association guidelines. Once you recognize cardiac arrest, you should start immediately within less than 10 seconds. Yes, again, because it will help circulating the oxygenated blood to the vital organs, mainly the brain. So we are pumping the blood from the heart to the brain to make it alive. And again, this involves a different technique called compressions and breathings. So we will give 30 chest compressions by keeping both the hands on the center of the chest. And again, after 30 chest compressions, again, we will give the two breaths to the individual. So again, this is a very easy technique. Anyone can learn easily. Yeah.
Okay, means in the center of chest we have to press for 30 times, right, sir?
30 times, yes.
Okay, and then for two
Then
second
again, we have
pause
to
and
give,
then again.
yeah, two breaths we can give. Two breaths
Okay,
using mouth to mouth respiration, or
okay,
if the people are having some barrier devices will be there, like pocket mask, they
okay,
can use that. In the hospital setup we use ambu bags, so
okay.
that it will
That
deliver
will
the
be useful.
breaths easily. Yeah.
Okay, okay, great, sir. And sir, in this session, my last question would be to you that what is first aid kit and what are the essential items that should be present in the basic first aid kit, and how often should a first aid kit can be should be checked and restored?
Yeah. So again, everybody has seen a first aid kit in their life. Either it may be in the two-wheeler or four-wheeler, or even a public transport, or in the airports or somewhere. Okay. So again, this is a collection of different medical supplies and equipment will be there. Again, it will provide some immediate medical assistance in case of any injury or illness or any emergency. And again, it includes different basic items like bandages, antiseptics, medications, gloves, thermometer, soap, crepe bandages, or sterile dressings, or even ORS packets, which are very essential for diarrhea attacks. So these are the different kits, different items we can keep in the first aid kit. And again, this kit should be checked regularly. Again, the size of the kit also depends on the number of working environment. And again, ideally every 3 to 6 months, we recommend to ensure that all items are present and also they were in a good working condition and within their expiry dates, because we are giving some medications like items. And it's important to restock any depleted or expired items promptly to ensure the kit is ready for use when needed. Yeah.
Okay, okay. Sir, my last question is doubt came in my mind that how a person know that this person needs a CPR. A
Yeah.
person
So
can be unconscious for some simple reason, and
yes.
how a person can distinct that those differences.
Yes, yes, very good question. So, because we have to recognize the person who needs cardiac arrest, that's a very
Hmm.
important thing.
Hmm.
Okay, so again, there are three checklists we have to keep in our mind if we want to start CPR. That is, one is unresponsiveness. That's what we say in an unconscious patient. We are checking responsiveness by tapping on the shoulders and calling them. There is no response. One more checklist is no breathing. So we have to check the breathing. The breathing we can check through simple chest rise. So
Okay,
chest rise is there. Yes, breathing was there. Chest rise was not there with unresponsiveness. Yes, the person needs CPR. We can check the
okay,
pulse, like carotid pulse was there, but if they are trained, they can check. Otherwise, no response and no breathing, they can simply start CPR, cardiopulmonary resuscitation.
okay. Thank you so much, sir. This conversation may save some life, and I hope people will forward this session to their friends, their family, so that a person can know the when they need to give CPR, and a person can save a life with this video. Thank you so much, sir, for this talk.
Yeah, yeah. Thank you so much.